So now that we've spoken a bit about infertility, the best person for me to talk to you about this is my dear friend, my teacher, and my mentor, Aliza Levin, here in Jerusalem, Israel. We're sitting outside a little bit, so you might hear some traffic. Aliza is a world-renowned expert on infertility. She's a nurse midwife. She's been involved in Chinese medicine and a master herbalist for many, many years, and I'd like to let her give her own biography. We're going to ask her autobiography, and we're going to ask her some specific questions. And then this is going to be part one of a couple of part series, because there's so much to talk about when it comes to infertility and women's issues. So, Aliza, thank you so much for joining me tonight in this beautiful Jerusalem evening. So, Aliza, tell us a little bit about yourself and how you got involved in Chinese medicine and your educational background and things like that.
Well, shockingly enough, I actually started learning Chinese medicine actually 50 years ago, because I'm an old lady, and I started learning it very young because Chinese medicine. Just masters, going to teach people in terms of education, college.
Okay, fine. All right. That's what I like to do.
Nursing,
When
I got to Israel, and a lot of people seek out fertility help with herbs, because herbs are not good for every problem, every condition. But in that field, I found it to be incredibly helpful. I've been practicing Chinese medicine and herbology for at least 30 years in Israel. When I first came to Israel, I was working as a midwife, and I found even then that herbs were incredibly helpful. For example, if a woman was like bleeding out of control, even as the doctor was drawing up methergine in a syringe, a fast drink of shepherd's purse, stopped the bleeding immediately.
Can I ask you a question? Besides, ask you to speak up a little louder, because I'm not sure what kind of microphone this is. I have a microphone here, and I'm not sure if it's so loud, of course. But what was the first time you actually even discovered herbs for this kind of treatment? Instead of, I came from a straight medical background, and it wasn't until I realized that medicine and surgery medicine is not always the answer, and I started doing research for different things, and I didn't even know about herbs, especially this kind of condition.
And honestly, when I first heard about herbs, I'm like, it's not going to help. It seemed like, drinking a cup of chamomile tea is going to cure an illness or difficult condition. Well, shockingly enough, there's a lot of stuff out there, and a lot of drugs were actually, started out as herbals, and it's a very, very long tradition and history. There's plenty of to talk about just that alone. But yes, herbs have been found to be successfully helpful in many, many, many conditions. And now the Chinese medicine texts and documentaries are available, this information is a lot more widespread than it was. When I first started out, it was just something weird that it's not going to help anybody. I thought that myself. But then when I saw the efficacy of these things, it works. I was actually shocked myself. First time I saw FSH go down to normal, I was like, wow, this stuff works.
So you were working in a hospital here first as a nurse midwife, and then you were studying herbology while you were working as a nurse midwife.
And I also was doing a lot of home births.
Home births, okay. And then you found that the herbs were invaluable to you, so you decided to become an herbalist.
Very much so. And that's even a strange story in itself. When I first got to Israel, people were sending me cabs in the middle of the night to come and deliver their babies. I'm like, don't they have hospitals here? What's going on? And there were communities of people that's what they did. So, I started working as a midwife, but it's that I saw that herbs were very helpful in that way. But the same thing happened with the herbology. Once I retired as a midwife, people started calling me and saying, you helped my friend when she gave birth, and it really helped. I have this other problem. I have a fibroma. I have this problem. Can I please come? I'm like, okay. And just took off. And that's before there was any Chinese medicine available in Israel. I did it with the Western herbs based on just chemistry. And somehow I'm still doing it.
Now you're using primarily Chinese herbs, though, aren't you?
I wanted to be using Chinese herbs, but I do use Western herbs, Indian herbs, whatever works, I'm interested.
And she doesn't now, Aliza doesn't just work to take care of women with infertility problems. She takes care of people with any kind of issue, but we're talking about infertility today.
Yeah.
So she makes a tailor-made formula to every individual who comes to see her after a big evaluation. So tell us what kind of people, though, will come to you, like you said, the fibromas or the older lady. Like, what are the kind of most common people that come to you with infertility issues?
I would say a great deal of my practice is devoted to women with fertility issues. And that could be that women, even young women, are told that they have POF, premature ovarian failure, which means the woman could be 20, 30, and she's told there's nothing to talk about, forget it, it's not going to happen. Or women have been rejected from getting fertility treatments because their hormones are just not showing it's possible. So a great deal of my practice is reversing early menopause, reversing premature ovarian failure, and trying to find out what's the problem. And there's a huge slew of possible problems that are under the banner of fertility. Reversing why it's not happening and building up the woman if I see that that's really the problem. When people come, so it's kind of a long process of me finding, I'm like a detective. I have to find out what's the problem. Why isn't this woman getting pregnant? Especially women that everything looks perfect on paper and just year after year, it's not happening. 25% of fertility problems are ascribed to men. So usually when people come to me, they've already gone the gamut of all the testing, everything looks fine, the husband seems fine, everything seems fine. My job is to look what's really going on in that woman's body doesn't seem able to get pregnant, be pregnant, maintain a pregnancy. And that includes women that have recurring miscarriages again and again and again. And doctors just can't find the reason why. Or, the husband has a problem, so there are herbs that are very, very good. All the herbs that I use are really very well researched in terms of what they do, what the chemistry, how they work. There's no mysteries anymore about Chinese medicine. It's no longer magic. And if it works, it works. And fertility would be a very big part of my practice, but that also includes menstrual problems that are underlying what's happening. And I don't know how much I should go into actual details, but if a woman's menstrual cycle is off, so that's something that obviously needs correction. The other thing is many, many women at all ages actually don't know that they're not even ovulating. They don't know the signs, they don't know the symptoms, they don't know how to check it. And, many women go to the doctor after a few years of marriage, not getting pregnant, to discover they're not even ovulating. And those are the type of women that come to me. I mean, with PCOS, which is, a whole issue in itself. We can talk about that. Women with thyroid issues often have fertility problems. All manner of problems that can exist, that can show up as infertility. So it's really very, very wide range of people that are women that in Israel, they have fertility services available to every citizen until age 45. So sometimes I get women that tell me, I'm going to be 45 next month. Can you start treating me?
And is that too late? Is that too late for someone to come to you 45 years old?
I would definitely recommend to come earlier. But I have had successes. In Israel, IVF is very popular because it's fully funded by the government. But I've had cases where I think if you want to hear a success, that was my best case. After 11 failed IVFs, woman got pregnant spontaneously. That woman is now a Chinese medicine practitioner. Wow. She was so impressed. That's telling me.
Oh, wow. Okay, that's incredible. Well, listen, one of the things I have learned in studying with Aliza for many, many years is that when you look for the root cause of what Aliza is, like Aliza said, it might not be a fertility issue in itself.
Right.
It may not be having anything to do with the reproductive organs. Right. It might be your digestive system is off. It might be that your thyroid system is off. It might be what other situations that you would say you have found success in helping people conceive after treating what issues?
Right. Well, it's like the issue of being a detective is really that trying to find the root cause of really what's going on. Why isn't this healthy maybe young woman not getting pregnant. What's the issue? So for me as a detective, I'm looking at, does the woman's body have enough what it needs to support a pregnancy? Does the woman even have enough of a blood supply to even support a pregnancy? And women that are like dehydrated all the time, women that are not eating well, women that are like strict vegans, women that donate blood all the time. And I hate to say this because it saves lives, but I've had so many women come to me and their period has stopped for a few months.
And athletes also, right? Athletes?
Yes. I had a flamenco dancer that her period stopped. Just too much action. So there are many causes, and they're very individual. But they do fall within the category of, I want to know, does this woman have enough blood volume to support a pregnancy? Because figured by 3 months into a pregnancy, that woman should have doubled her blood volume. But she doesn't have enough for her. So it's not likely that the intelligence of the body will think that that's a good idea. I always look to, what's the body communicating now? If a woman, everything looks totally fine and she's not getting pregnant, it's like I'm looking, what is happening with this woman that pregnancy would be too much based on the intelligence of the body for it to happen? And then things start to become very clear. For example, as I said, I ask a woman, if you're not drinking at all, where are you going to get liters of amniotic fluid that's supposed to come from your blood? It's just not going to happen because it's not going to happen.
So you're saying it's correcting something as simple as being properly hydrated and eating good nutritional sound meals and having enough protein. I know that's what Aliza's big drilled into my head. I ask every patient whether they want to get pregnant or not. You think you're eating enough protein? Because blood, it makes blood in your, the good quality blood that we need.
That's it. So if a woman comes to me and I see on her blood test that she doesn't even have enough blood for her, she has like what's called microcytic anemia. The red blood cells are so teeny that she just doesn't have enough of them. So that has to be addressed. Then I'll find out she's a strict vegan. She's not drinking at all. She's running around. She may be the executive of some big firm and be making a nice career for herself, but it could be that she's exhausting her resources. She is not taking in enough to be able to support a pregnancy. So those are things that I speak to women about and find out about her eating, or their drinking, or their habits, all these nosy things that help me really find out what's really the problem here. Because there are a lot of strange ideas, strange diets out there, strange trends out there that I really have to find out, like, does a person have the digestive strength, for example, to be on a raw food diet, which could be perfect for one person and problematic for another person, and just following a popular diet might not be ideal for every person. So those are things that are very simple to correct. Or, for example, a woman has a very short cycle, and there's just no time within that cycle for her to have a proper ovulation. So that would be something that I would give herbs to lengthen the cycle, give herbs that would strengthen ovulation. Of course, they have to learn the signs and symptoms of ovulation because that's the only time they can get pregnant. And shockingly enough, I speak to women with 10 kids that don't even know the signs and symptoms of ovulation. Luckily, it happened with people. So all these kind of things are very individual, but they do go into the category of a woman has to have enough physical strength to carry a pregnancy. It's like Chinese medicine has the concept of that the body is like the vessel receptacle for the pregnancy, and if the woman is very weak and very tired, just not up to it, so it wouldn't be surprising that things are just falling out. And strengthening the woman in Chinese medicine is considered strengthening the kidneys, even though that may sound very strange concept, but given these kind of like diagnostic things that explain, it's very simple. They work. A woman that's had constant miscarriages, strengthening her ability to carry pregnancy, has been very successful. There's no 100% of them. It's unrealistic to think that every woman that ever came to me pregnant, that over 30 years, I would be very happy to have a big party with all of them.
What percentage of people do you think over 30 years and all the women that you've seen, what percentage you say were successful?
Well,
because of the herbal treatments.
Right. It's hard for me. It's hard for me to assess that. But I just want to mention another side line that I have is that I'm a research associate at Hadassah Hospital in Care, and I work in the complementary medicine research group. So every year we used to have a meeting with all the medical students because unfortunately doctors do have the idea, even till today, that once a woman is showing clear menopause symptoms, we can call her FSH, the hormones way too high, estrogen is way too low. They won't even offer her fertility services because they think it's a waste of time and money. And they do not consider that to be reversed. This is 100% not the case. And we used to present our findings at the hospital every year, and we often invite ladies to come with their babies that we're told that it's not possible and they could never have a baby. If anyone's out there that's been told this, it's reversible. Herbs are very helpful and successful for that particular problem, and that could be premature ovarian failure at any age.
What does that mean exactly, premature ovarian failure?
It could be for a lot of reasons, and that's part of my diagnostic detective work, is to find out why did that happen at that particular moment.
You're saying a young woman goes through early menopause.
Yes. She may not even be aware of it because she thinks everything is fine. Typical cases, a woman decides, okay, I think, couple's married, it's fine, and then they decide together to have a baby after they're trying and trying. The woman had no idea that she wasn't even ovulating all that time. People don't have signs and symptoms, they didn't do any blood tests because they wanted to pursue fertility in that case. What I found is often, and this is strange, often after failed fertility treatments, a young woman can go into premature ovarian failure. That means that she stops producing the hormones that are needed to build up the uterine lining. It stops the process of ovulation altogether. And the lack of estrogen not necessarily starts with menopause symptoms and hot flashes and all those things. That could be different session.
Menopause, we'll definitely do menopause.
Herbs are incredibly helpful for that. And I not only treat it all the time just for discomfort, but reverse the whole fertility of 1 kid, 2 kids, 3 kids. I have plenty of patients that are in that situation. So it's hard really to say why a woman would go into premature ovarian failure. One of the causes that's surprising is excessive bleeding. Some women are at a hemorrhage level of bleeding every month. It's just too much. And they're very intelligent, and the brain says enough. It just stops the whole process. Other things could be involved with medications that they're taking, other conditions that are involved. Thyroid issues will often interfere with fertility situations because the same pituitary that's producing the follicle stimulating hormone is the same place that's producing the thyroid stimulating hormone, and they have opposite messages. One says burn fat for energy, and the female hormone producers say store fat. We need female hormones. So sometimes a woman could be in a very delicate situation that she's on thyroid medications, she needs thyroid medications, etc. And absolutely yes. One of the things that is always looked into when a woman presents to a regular medical clinic for fertility problems, they'll always check thyroid. So and that's just one of many possible reasons. I also deal quite often with girls, young girls. They're already 18, 19, no period at all.
I was just going to ask that question. How do you deal with it's called amenorrhea? That means you haven't had your period, no menstrual bleeding. And I've had a few girls come to me like that too, that until they decide to get married. We live in a very religious community, so the girls will start thinking about this when they're marriageable age. And surprise, when was your last period? Oh, I never had one.
Right.
18 or 19 years old. It never bothered them because they didn't know it was a problem.
Right. And unfortunately, or fortunately, the medical way of treating this is to put the girl on birth control, and that will ensure a monthly week of bleeding. But that's not a cycle. That's not ovulation.
It's forcing the body to bleed.
Right. And if the body wasn't up to bleeding, if the body didn't have enough blood volume in the first place, which is a possible reason why it happened, there are many reasons why that can happen. one of which is donating blood. Some girls without periods should not be donating blood. They clearly don't have enough. And it does that you mentioned protein intake. Some women are, for whatever reason, on like super diets or trying to be as thin as possible, may not be getting the food that builds protein builds red blood cells. So it's the amino acids in the protein. But some people are just not taking enough to produce blood. And I can detect that immediately in the blood test. The red blood cells are size me. All kinds of things that you can really see at great detail. Just plain CBC.
So when somebody comes to you, and I know the answer to this, but I'm asking you, what do you require of them to bring with them to see you before, they fill out, of course, an extensive survey form that you go through in detail, but then what else would you like to see?
I mean, it's very helpful, and I, of course, want to see any recent blood tests that they have. Of course, I want if they're undergoing any fertility treatments, in which herbs are a fantastic adjunct, by the way. Of course, I want to see what the protocol is. I want to see what medications they're being given, because it might be a different herbal formula to build up the uterine lining if that's the problem, to make more follicles if that's the problem, make sure that the implantation is fine if they're undergoing IVF. There are many stages of all of these things. And of course, I want to fine-tune the herbs to the procedures that they're doing, and for that reason, of course, I want to know what they're taking, all the supplements they're taking. It's really an arduous process finding out all of these things, and so the more information that people can give me, the better. And of course, if there are underlying problems in other areas, of course, I want to find out about that. What are the treatments? Are they on medications that could be a problem? And there are medications that can interfere with fertility for sure. So all of that is very important to me.
Okay. And then on the average, and now everybody is different, how many months would somebody, how many years or whatever, how long would somebody have to be on a herbal medicine to see some results?
Right. It depends again on the individual problem. But I would give like what would be considered even in regular medicine, like a gynecological period of time, which would be 3 months. And there's a reason for that, is that it does take even 4 months for blood to form, grow up, be red blood cells, and go from baby rotation sites to full blown actual red blood. It's really not a cell, it's a focus. But meanwhile, it's like if a woman is very, very blood deficient, she's severely anemic, really in a bad state when you start a pregnancy, it could take, with proper diet, proper nutrition, and herbs, it could be 3 months until she's ready for a pregnancy. How would I know it? Of course, I would want to see ultrasounds too. That would be a woman who's being told, I'm sorry, your uterine lining is too thin to support a pregnancy. And for example, a woman undergoing an IVF treatment, for example, if everything has been completely successful, time to put the fertilized eggs back in, they won't do it if it's not at least 7 months. So a woman that just doesn't have enough blood, because everything to do with fertility has to do with blood. In the sense that if there's no blood, there's not going to be a uterine lining to even support a pregnancy. And if the woman doesn't have enough blood, she'll actually stop the period. A very radical example is when you see situations, God forbid, starvation, Holocaust, or people, a population that's just not able to, build up their blood, hormones go down. You find that birth stop, period stop, and it's not a hormonal problem. For example, after people were in the Holocaust, afterward, it's like they didn't have periods because there wasn't enough nutritional intake to produce blood, let alone keep them alive fairly. But afterwards, these women didn't have hormonal problems. After it was over, they went back to a normal life, normal eating, and a whole generation was born. So it's sometimes as simple as there isn't enough blood being produced, and a woman, and many times people come and tell me that they're on the healthiest, best diet. Of course, I want to find out what that means. And often it could be, oh, I never eat protein. I heard it's bad, or whatever. And
or fast.
Or right, yeah, yeah, absolutely.
Low fat craze that we've been,
Very
brainwashed
unhealthy.
to.
Very
Yes, I agree.
unhealthy. And even more shocking to people is to find out that they better be eating cholesterol because that's what their sex hormones are made of. All sex hormones, estrogen, progesterone, testosterone, all, not just female, all human sex hormones are made out of cholesterol. So people that are frightened by it from, wrong ideas, wrong advertisement, or whatever, that, oh, I never eat animal food, I never eat. That doesn't mean that a person has to eat animal foods or anything that they're ideologically, against. There are plenty of substitutes. There are plenty of alternatives that, can help them find, that can give them the proper nutrition. But a woman on a starvation diet is going to have, if a woman on a starvation diet finds that she's not getting pregnant, that's the first thing that I would do to start asking them, talking to them about, like, at least drinking enough fluids. And I mean water, tea, juice, soups. Some people are chronically dehydrated, and that's what blood is made of. It's a fluid. So it's not just the red blood cells. Red blood should be 2 parts red blood cells and 3 parts water. But if the woman is not getting enough fluids, or other people have a different problem. They're drinking like crazy. It's just pouring out of them. So that's another problem that I, as a detective, have to find, solve, and see what's going on. And how would I know that it's being corrected? Very simple. I can see a regular blood test. If the blood volume is adequate, I can see the proportion of red blood cells to the rest of the blood. I can see the size of the red blood cells. Like if the red blood cells are too big, that might indicate B12 deficiency. If they're too small, it might be B6 deficiency or iron deficiency. So in other words, it's not, every anemic woman is not going to get pregnant. Not the case at all. But if I see clear indications, and a woman says, I haven't had a period in months, so let's get the blood back. And often that's all that's needed. Sometimes I just tell women, look, of course I'm going to give you herbs, but if you're not drinking at least 2 liters a day, most human beings are, drinking a liter and a half. Breathing takes 2 liters. So if a person is just pouring out, urine and not putting back any fluids, I mean all fluids. So they're going to get chronically dehydrated. And can that affect fertility? Absolutely. Can that affect pregnancy? Absolutely. Can that be the reason that doctors are saying you don't have enough amniotic fluid? Absolutely. Can that be corrected? Yes, it's called drinking. So,
yeah, we sometimes have to tell people to do the simplest of things. I tell my patients all the time, you're paying me to tell you what your mother always told you, which is drink enough fluid, eat your vegetables, go to sleep early, and thank you very much.
Right, right. Or there are, like we mentioned, like athletes, dancers, runners. Those women are often literally expending so much energy on their hobby, their sport, their profession, that they simply don't have enough energy to be. I don't mean that they're tired all the time.
Which they also can be.
Also, right. But every movement of a muscle is utilizing blood. A woman that her profession, and I had a few, is dancing for hours as her profession, etc. That woman is utilizing tremendous body energy, blood, and she may find herself just too depleted. Other cases like that, I feel, strangely enough, I felt very much with women that are like high-powered executives, flying all over the world, they have companies, and they're putting out so much what Chinese medicine would call life force. They don't have enough to support another life too. Again, going back to the concept of the blood, a person has to have enough blood volume for them and the next generation too. And period blood will be extra from that. So if there isn't a drop to spare, first of all, fertility can be involved, infertility can be involved, but that the period can stop. And then when I go through everything and I look, their hormones are totally normal, everything looks fine, blood work is fine. Then I find out they're not eating anything, they're running all over the place, they're flying all the time, which is very dehydrating.
One of them probably older ladies as well, compared to.
Because nowadays it's very popular to, first get the career going, get the money to have the kid, is, a common sentiment. And women only start thinking about fertility in their late 30s often early 40s, sometimes mid 40s. And Israel will support that, I told you, until age 45. And often these women are simply so depleted, so tired, they're not sleeping, they're running around, they're doing lots of important things, but something's got to give, and it's the next generation. They've got enough. Another typical thing is women that are addicted to working out. These are women that are like running for hours in the morning, then they've got to go to the gym, and these women feel like they don't feel good if they don't do that. And it's very interesting why, because these blood deficient women feel good when the blood is circulating from all their movements, but when they're just sitting there, they don't have enough blood, certainly not enough blood to support a pregnancy. And often, like the typical athletic situation, the period stops. Ironically enough, in the early 80s, they started to study this. So this was all discovered because they figured, let's take the most healthy one possible. Athletes, they're so healthy, they're, doing all these athletic feats. They're the top of the line. What they found was often these women had no periods, these women were not ovulating, and had serious fertility problems. That's when all of this really came to light, that it's like, no, something's got to give, and a person has to know what their priorities are. And often when a woman is starting fertility treatment, serious, even IVF, she's flying to China for her business, she's running to India, she's the head of this. It's like,
and we have to learn how to take care of ourselves. This whole concept of self-care is not a joke.
Totally,
If you want to make a transition of becoming a mother or even any kind of transition in your life, you have to put the effort into doing so. I want to ask one more question before I have to turn off because I think we're going to run out. And we're going to do a few more sessions. I want to talk completely about menopause another time. I'm going to talk PCOS another time, irregular periods. There's a lot of things we need to cover.
Sure.
But I've always wondered how and I have big respect for medicine. I come from a medical model, but a nurse anesthetist.
We need them.
30
We love
years.
them.
My husband's an obstetrician
RN.
gynecologist. Okay, I'm very respectful, but I never could understand the concept of if a person is depleted, to give them a medication to just pump the ovary, to produce.
It's
very. The Clomid is what they use, and it just pumps and pumps and pumps. And if the body doesn't have what to give, how does that actually help? It does though, because people do have success with that.
It does. It does in many situations. But that's a very, very important question because a lot of the people that come to me are actually undergoing fertility treatments at the same time. So it's really, it goes back to almost the same concept. Hormones are messages. The message of, let's say, estrogen, which goes with the uterine lining, develops the eggs into follicles, and is crucial for pregnancy, obviously. It's just a message. What's the message? Blood to the uterus, please. Blood to the uterus, please. If the woman does not have enough blood, medications will force it. And then, in other words, let's say a woman, again, we mentioned the 7 millimeter minimum. So if a woman doesn't have enough of the uterine lining to support a pregnancy, they'll give her more estrogen, which will pump it up, but it will deplete her. So hopefully the pregnancy will still be okay. If it's borderline, it might be okay. I've had the mainstay of the women that come to me are women that it did not work because they just don't have reserves. So many women are like on their back. They've used their reserves already. They're exhausted. They're starving.
Maybe their lower body isn't strong enough to hold this too.
Also,
there's that whole concept of certain organs in Chinese medicine are attributed to giving you the lower body strength.
Right, to hold up against gravity even. And those are women that, there are even women that have to have their cervix sewed shut because things just fall right out. These are people that, they drink.
And the herbs can help strengthen that.
Definitely, absolutely. So I found that it's hard to say the number one problem is X, Y, or Z because it's so individual. But I always look at questions like, where's the blood? Where's the strength? And within that, there are many scenarios and personal things. So as you can see, it's a lot more complicated than take herb X and you get pregnant, take herb Y, that will do the job. It's much more complicated. In my practice, I don't use like the classic formulas. I construct for each individual person exactly trying to address what the problem is. And yes, it can take 3 months. A woman with no period at all, she needs to build up the blood in order to be able to do that. Or for what, there are many, many situations that I'm just scratching the tiny surface of just some of the categories of the type of people that have these problems. And a lot of the people come to me, their hormones are perfect on paper. Doctors can't understand what's wrong. Maybe it's psychological. Often it's not. It's one of those in between the chair reasons that nobody is even thinking. Nobody thinks of dehydration as a cause for infertility, but it could be a big factor.
Aliza, thank you so much. It's really fascinating. We're going to have you back many more times, I hope. And we're going to start, Aliza's going to start a course in teaching people how to do everything from read their own blood tests to get themselves ready for pregnancy. And Aliza can be reached. We'll publish her information on the sidebar when I do the live. And you can call her anytime she has a secretary who will take your appointment. And you can make an appointment with her in Jerusalem.
You can ask questions that I'll be happy to answer.
Right, and also you can, it doesn't matter if you live in Israel or not. Aliza can
No problem.
give you a Zoom meeting or anything like that, some advice, and maybe send you some herbal medicine, Chinese herbal medicines from Israel. I just like that. So thank you, Aliza. Thank you so much for taking a very busy time to join us. Love talking to you, and we're going to do it again soon.